Getting any health insurance when you have a pre-existing condition, though, can be a big problem. Senior medical correspondent Elizabeth Cohen joining us now with tips for those people who find themselves in this very frustrating and, quite frankly, scary position.
It is a scary position, and that's one of the reasons why the government is thinking about getting into the health insurance business, because nobody's taking care of this group of people. So these are people who have pre-existing conditions. They apply for insurance on their own because for some reason they can't get it through their employer. And guess what? 1 out of 5 times that people apply for insurance, they're told, no, sorry, you have a pre-existing condition. Or, you have a pre-existing condition, so I'm going to charge you a fortune in premiums. Or, well, Mrs. Smith, you have diabetes. I'll insure you for everything but your diabetes.
Yeah.
So, huge problem. Millions of people are facing this.
What did you say, 1 out of 5?
1 out of 5 people who apply for private insurance have trouble getting it because of a pre-existing condition.
All right, so then what do the options become? I mean, you just said it. A lot of people have pre-existing conditions.
Well, a lot of people think there are no options, and that's why we took this on as an Empowered Patient column, because we wanted to see, is there something out there? And we found that there actually are things out there. It's not easy. I'm not going to sugarcoat it. It's not easy, but there are ways to get help. For example, people don't realize that in 12 states, you can become a group of one. So you become a group all by yourself. And the beauty of that is that with group insurance, the kind that you and I enjoy as employees of a company, when you're with a group, they have to insure you even if you do have a pre-existing condition, and they can't make the rates really high. So you can become a group by yourself. In every other state, you could be a group of 2. So somebody I talked to said, go start a landscaping business, employ your brother-in-law, and all of a sudden you're a group of 2. There you go. Here is another hint, is that you can join a state high-risk pool. These high-risk pools are for people with pre-existing conditions. Many states have them. And if you go to cnn.com/health right now, you can see the list of states.
Okay, very good. But always more expensive? Typically more expensive?
Not always more expensive. Sometimes it is, sometimes it isn't. It varies by state. And that's why in the column this week we have links to lots of state information because it varies by state.